Hello, I'm Dustin Bass, and I'm the president of the Nevada State Council Emergency Nursing Association. I hope everyone is staying safe in the current environment of COVID-19. I know it's been severely affecting all of us in one way or another. I want to start by expressing my deepest sympathy for the recent loss of one of our own ED nurses in Nevada. That nurse served on the front lines, caring for those with COVID-19, and then ultimately passed away. I can only imagine the pain her loved ones are feeling, and I truly have the deepest sympathy for everyone who knew her. I also want to extend my heart and my sorrow to all of our lost healthcare workers during COVID-19 thus far. We are without a doubt in a war against an invisible enemy. And I can say with a fierce belief that every loss of a nurse, doctor, or healthcare worker is felt in the heart of all of us. I'm truly sorry. During times like this, we all seek clarity in one form or another. Spirituality, debriefing, self-care, or simply talking it out with others are all ways we can gain some type of personal clearness into what is going on around us. When I graduated nursing school, our nursing professors handed us a poem on rainbow printed paper. I remember crying when I read it, and then realizing I had made the right decision to become a nurse. Still to this day, when I question why I became a nurse, I read it to myself. I think I'm going to share it with you here. Being a nurse means you will never be bored. You will always be frustrated. You will be surrounded by challenges. So much to do, so little time. You will step into people's lives and you will make a difference. Some will bless you, some will curse you. You will see people at their worst and at their best. You will never cease to be amazed at people's capacity for love, courage, and endurance. You will see life begin and end. You will experience resounding triumphs and devastating failures. You will cry a lot. You will know what it is to be human and to be humane. In the confusing times of COVID-19, I have also found that we look for resources. And so I also wanted to share with you some resources that I have found useful thus far. So here we see the latest information regarding COVID-19 on ENA's website. They have this really great information page that provides emergency nurses the latest information and clinical best practices to support their work. It's frequently updated. They're always adding new information. And so I highly suggest that you go here and you check it out. There's educational information that you can provide to your staff or for yourself. There are self-care resources there. There's a multitude of resources and various different avenues. One of these pictured here is the visual abstracts I thought were very interesting and something that could easily be printed out and hung in the unit or spread around to your fellow emergency nurses. So I think that that's a really great resource that they have on there. The ENA, of course, also encourages everyone, including all healthcare providers, to refer to and follow the Center for Disease Control and Prevention's latest updates regarding COVID-19. So that's always a resource that you have as well. Here are some of those other visual abstracts for COVID-19. This one is priorities for testing patients with suspected COVID-19 infection. And then this other one is what emergency nurses should know about caring for patients with confirmed or possible COVID-19 infection. Again, these are visual abstracts that you can easily print out. And a lot of times in the chaos, I have found that using visual aids can sometimes help your staff really connect with the information. So I really did like these and appreciated these on top of all of the information that was available on ENA's COVID-19 section. The next thing I wanted to talk about was the recent email and notification that ENA National sent out. So Rooms for Responders is a program with Marriott Bonvoy, which offers no-cost hotel rooms to members working on the front lines in some of the nation's hardest hit COVID-19 hotspots. And those include California, Washington, D.C., Illinois, Louisiana, Michigan, Nevada, and New Jersey and New York. And so you can go to their website here at this link to learn more about Rooms for Responders and potentially book reservations if it's something that you're interested in. The next thing that I plan on attending is the ENA Together virtual town hall with our national president, Mike Hastings, and the board of directors. It will be on April 10th at 2 p.m. Central Time. You can register for it here at this link. So you click here, just put in some very basic information. It's an opportunity for everyone to share experiences, resources, and support, as well as tips for self-care. So I think that's really important, and it will probably be a really good informational session with some really great people in the world of emergency nursing. So I'm excited to see what that has in store for us. On the same token, the Emergency Nursing Association is putting on a virtual symposium for the public health crisis called the Public Health Crisis and Disaster Management Virtual Symposium. So it's in response to the current public health crisis. ENA has coordinated this virtual symposium, and it's designed to provide emergency nurses with lessons learned and best practices in disaster management and preparedness, resiliency, as well as leadership in times of crisis. And it is going to be packed full of really great speakers focused on dealing with this public health crisis that we're all living every day. So it is free, it's informational only. It's a live virtual symposium on April 14th. It starts at 8 a.m. Central Time and runs until 6:30 p.m. Central Time. It's packed full. You can join live on April 14th. It's for members and non-members. It's a free resource. And then after that, there'll be access to the recorded version throughout various timeframes. And you can follow this link here to register for it, and then to also get the full agenda, the listing of classes, and when it's available. So I highly suggest you do that as well. I think it would be really great. The last thing, or not the last thing, but one of the other things I wanted to talk about is Talkspace. So Talkspace is a therapy app that's currently donating free therapy to medical workers that are fighting COVID-19. So they are providing 1 month free access to their Unlimited Messaging Plus plan. And I'm not afraid to admit that I needed some help. And so, and I'm a huge advocate for therapy. I think that it is a great resource for people who need it. And so you can go on there, and during the intake, it was very easy for me to just send them a picture of my badge, and they sent me a code for the free month. And I've been using it for about a week now. And so 5 days a week, you can text your therapist, or you can do a video chat, or you can just record something to them. And then twice a day during those 5 days a week that they're working, they'll respond and give you some really great insight, and sometimes just give you that outside perspective that kind of takes you out of your own world and into, you know, a way where you can look at things differently and maybe reframe some things that are going on right now. So it's a great resource. I highly suggest it. And then the last thing that I did want to talk about is we are really excited to introduce a concept called the In It Together Tribe. And so we're working on this, and it is still a work in progress, but we have some really great people confirmed. And so what it is we want to connect to help each other make it through what's going on around them. And so we called it the In It Together Tribe, because we really all are in it together. And so during tough times, especially during COVID-19, connecting to one another and expressing our raw feelings is vital for our mental health. We want to provide our emergency nurses with ongoing opportunities to deepen our sense of community while debriefing, sharing, grieving, rebuilding, and renewing, especially during this time of isolation and social distancing. On a virtual platform, Zoom, we will have an expert available to help guide the discussion as a group. After each weekly session, attendees will walk away with meaningful tools to help each of us face the onslaught of the everyday emotional challenges of life as we know it now. And so one of our first ones will be Raw Enforcements with Kitty McKay. Some of the other ones that I've spoken to some people about will be Debrief Your Grief with Melanie Marsh, and then Self-Care and Calm with Kristen Klein. And we are working on getting some other great people who can help facilitate these virtual discussions and make sure that we have a variety of people that you can really connect with. Of course, it's a free resource that we're going to put out there for nurses on social media, you should just be able to click the link and join in and participate as much or as little as you want. And then my hope is to also record those sessions so that even if you can't participate live, you can watch the recorded session and potentially get some really great information out of those. Because I think that we really are all in it together, and we are a tribe because we're nurses, healthcare workers. That's what we do. And by connecting, we really can help each other make it through. I'm a very strong believer in that. So thank you all for your time tonight, for checking out this update. And I hope that you'll be looking for more information on the In It Together tribe. We'll be sending that out on social media and then also through email. And then all the other events and resources that I spoke about, we will also be sending those out so that you can have easy access to them. Stay safe out there. And if you ever need anything, please reach out. I will do the best I can to help you. Thank you.